Welcome back to The Factor Uncensored. A Houston doctor is facing up to 10 years in prison for allegedly accessing young patients' information at Texas Children's Hospital. Dr. Ethan Haim has now been indicted. He leaked files from Texas Children's Hospital back in May of 2023, according to the prosecutor, which reportedly showed staff provided gender-affirming treatment to kids, despite the hospital saying they stopped those treatments in 2022. Ahead of the Senate Bill 14 becoming law. Dr. Haim says he is innocent and that documents did not contain any personal patient information. He also defends himself on X, writing, quote, "I blew the whistle on Texas Children's secret sex change program, and the Justice Department came after me for exposing the truth." Joining us to talk about it, Texas State Representative and attorney Ron Reynolds and President of the LGBTQ+ political caucus, Austin Davis Ruiz. Glad to have you all here on The Factor. When you see this kind of behavior from a doctor who promises to do no harm or reveal patient information, your thoughts on this, Austin?
I mean, it's not entirely shocking at this point because of the way that we've seen a concerted effort to attack the trans community in today's political climate. But it is really saddening to see that this is the level that people are trying to stoop to in order to silence trans people and erase them from existence. I mean, gender-affirming care has been shown to be life-saving for trans people. It is backed by every major medical association in the country, and this is care that also cisgender patients access on a regular basis. So why are we denying trans people that same health care?
Ron, your perspective from an attorney when you look at a doctor behaving this way, your thoughts on this. What did he violate? Where did he go too far?
Well, and I agree with his sentiments, but the doctor has a duty to keep patient information confidential. These were not patients of his. He sought access from the Texas Children's Hospital to gain access to files of patients that were not his patients. Then he intentionally leaked that information to the media. So he's no saint. He had an agenda. He wanted to he was a Republican, basically a conservative troll that was against gender-affirming care, and he was trying to expose these people, and that's what he did. He wasn't trying to go and say, hey, what they're doing, they shouldn't be doing. He wasn't trying to go to law enforcement. He wasn't trying to go to the Attorney General. He was trying to put them on blast and get credit from the far right of his segment. That's what he was trying to do. He wasn't really trying to do anything to help these patients. He was trying to get some clout.
And Austin, what we will likely see now is his defense being, I'm a whistleblower. I'm protected by the state of Texas, by the federal government, and I was doing what was best in the public interest.
Well, let's make sure that we clarify that the Texas Whistleblower Act is supposed to protect public employees, right? That does not necessarily apply to employees in the private sector, right? Yes, there are exceptions for certain types of healthcare professionals. Unfortunately, this is not one of those situations where we're going to say.
And at the time, he did not work at that hospital.
Exactly, right. Right. He was, I think, in residency or something, and he asked to have his login reactivated with the intent to specifically gain access to these confidential patient files, to access their information, their treatment codes, and then to leak that to the media. To me, this seems like it's going to be a pretty open and shut case, just based off of the egregiousness of what he was trying to accomplish.
How damaging is this?
For him, this is extremely damaging, and I can't imagine him having a medical career after this if he cannot be trusted to keep his patients' confidentiality, right? That is the basis of medicine, right? That you were supposed to act in good faith on behalf of your patients, that you were supposed to do everything in your power to ensure that they get the best care possible, not leak their information and you know, put out all of their personal information out there into the world.
Representative Reynolds, we see this as black and white. Right and wrong. Is it that simple when you get into the courtroom?
Well, it won't be that simple. I mean, he's going to have a defense that he was protected by his whistleblower status. But it does seem, though, that he broke his oath. A doctor has a high duty. I mean, this is an oath that he takes when you're a physician to protect patients' confidentiality. There's HIPAA violations, there's legal ramifications. He knew what he was doing, and he intentionally did it. I don't think he's going to be able to hide behind it. One thing about it, this is the U.S. Department of Justice. They do their due diligence. They don't just go rush into cases. Whenever they indict someone, usually they've done thorough research before they go and prosecute.
And this was pretty fast for them.
Yes, sir.
All right. We want to thank you both for joining us here on The Factor. We'll